I'm Dr. Vu Ho. I'm a board-certified facial plastic surgeon in Plano, Texas. Welcome to our podcast, and I have a very special guest and patient of mine, Deandra Simmons.
Yes, I'm glad to be here, Dr. Ho. And we discussed before, I have been a patient of yours at Beyond Beautiful for almost 3 years now. Can you believe that?
Oh, time flies. Yes.
It has, and because of you, luckily people always have a hard time guessing my age.
That's great. You know, I think it's so important in the type of work you do and all the things that you're involved in is really prioritizing your appearance and looking your best. But I think that's true of everybody. I mean, who doesn't want to look their best for whatever age or place they're at?
I told you before that I think it's harder for me because being in the public eye and people scrutinize you. They're always looking at your skin. They're always looking at, how old you are and if you look good, if you don't look good. And a lot of times, jobs depend on. I mean, unfortunately for women, as we get older, it is so hard. And because I've been going to you, people always think, oh, you look so good. You don't look. I will be 53 in about 2 weeks. So you've really done a lot for my skin and my appearance and my confidence.
Well, I thank you. It really takes a partnership, and the doctor-patient relationship is something is so crucial in working with somebody that you really understand and can meet their needs and understand what they're trying to achieve. And for Deandra, I mean, she's gorgeous. We already know that. But we want to keep her looking that way. We want her to lose ground. And for me, the priority was, how can I take this gorgeous woman and keep her looking that way without the telltale signs of having a lot of work done? I mean, that's really difficult to do. But I think we've done a pretty decent job, and they're still doing it. It's an ongoing process. It never really ends.
Well, I'm always coming to you and saying, okay, I want you to fix this, I want you to fix this, let's do it at a certain time when I have some downtime. But some of the things that I had in the very beginning, I had never had before. We did the Bellafill, was the first thing that you did on me. And let's talk a little bit about that, what that does.
Yeah, Bellafill is a great product. It's an injection type of filler, but it's long lasting. Some people call it a semi-permanent filler. And that's because it's shown to last 5 or more years. And I chose this particular product for Deandra because unlike other hyaluronic acid filler or traditional fillers that simply dissolve over time, this actually builds collagen. So the patient will see the results look the best in about 3 to 4 months as that collagen production builds up. And the patient maintains it. So it's one of those great options for someone who has a busy lifestyle, who can't keep coming in frequently to have treatments. And once you get the Bellafill treatments, you're good for quite a while. And I think the other thing I like about it is it really enhances her features and just highlights the nice features she already has, but in a very natural way.
Well, I agree with you because I do notice that the Bellafill has, like you said, long-term effects of helping to increase collagen production, and it's not like a typical filler I've had before. Plus, the way you actually implement it is much different with is it called a cannula? Is that what you use?
Yes, I use a cannula, which is a really tiny tube, to put it in simplistic terms, and instead of a sharp needle. And by delivering it into the skin, into the tissues, it does it in a less traumatic fashion. There's less bruising, less swelling, and much more comfortable.
Well, that was my point, is that when I've gone to Dr. Ho over the years, I literally have almost zero bruising, which is not the norm for me. Before I would have a lot of bruising. And I can see you, and I can go out that night, the very next day, a couple days later, and if I have any bruising at all, it's so minimal, nobody would ever notice it. So that's the appearance or the marksmanship of a true artist, which is what I believe that you are, because you've definitely been an artist for me. And so I just want you to know that that's something that I just really appreciate in the line of work I'm in.
Yeah, I mean, that's so important. And last thing we want to do is create a bruise that now a patient has to deal with and try to cover up. So I will do everything I can to minimize that chance. And that's simply using things like a cannula. I use ice or cold compresses before I do my injections. So we take precautions to try to minimize that risk as much as possible.
What I also like about you, Dr. Ho, is that you really focus on one thing, which is faces. And a lot of plastic surgeons, they will do, several body parts, but I think if you really focus on the one area, then you become a specialist in that, and that is your thing, is faces. Facial plastic surgery, injectables also, and different treatments, but because you're working on faces every week, you become better and better.
Yeah, absolutely. That's really important when looking at a provider or a specialist. You really want that person to have a strong focus on that particular area that you're interested in. And I think there's a lot of stuff going on in the face, so that is plenty to keep me busy and keep me focused. I love the anatomy. It's very intricate, very unforgiving in many ways, but if you know how to utilize it and work with it, the results that you can get can be amazing.
Let's talk about something that I know you've seen several of my friends, because we've had different events and things like that. Tell me about timeline. So when should a woman go from injectables and fillers into, okay, it's time to get a facelift? Because a lot of my friends, I'm like, you can keep doing all this kind of touch-up stuff, but you really need to get the full the facelift at this point, because there is a certain time when it's time to just go for it.
Yeah, that's a great question, because we want to know what is the ideal time. And it's really what I would recommend as a professional and expert in this area, as well as lining that up with what the patient's desires are. Some patients cannot have a lot of downtime, so they cannot have a more invasive procedure or a prolonged procedure. So we take that all into account, but I think the best way is, do the simple things first, and that often involves things like injectables, laser skin treatments, something like that. And when the need arises, when you might need something more substantial like a surgical option, that's where we can talk about what it is might be best for you, and the associated downtime and.
So if you're doing, say you're somebody that's proactive, so in your 30s, 40s, whatever, you're doing your Botox, you're doing your fillers, you're doing everything, so you're just preventing. So then when you come time to, okay, I'm 50 years old and I'm having a facelift, would you say that actually helps with, it's not so dramatic, and also it helps with recovery and all those kind of things?
Yeah, I think your tissues are in better shape the younger you have a surgical option, so you're going to heal better, recover quicker. And like you said, things are just going to move along much better, and it's not going to look so dramatic of a change. If you waited till the aging process is so far off, and then you do something, well, it's going to be very obvious.
And as we get older, our skin's elasticity changes and gravity takes over. And I think if you wait till you're too old to get a facelift, this is my opinion, then it is going to look dramatic. It is going to look different. It is going to look more pulled, instead of kind of doing it, right when you need it, but it's not too drastic.
Yeah, definitely. I like the step-by-step approach. Maybe you need some eyelid work, and you're good for a while, and then you need some contouring, and then some lifting. So you're right. I think that kind of approach is the results look much more natural, but it's just not so shocking to the system, I guess.
My husband always says, well, when I moved to Dallas, all these women, they look like, they were driving down the freeway and their head was out at 70 miles per hour. They're all so pulled. And I said, well, that's because they didn't do the procedures the right way and go to the right surgeon. But I appreciate you have a more conservative approach. I've seen a lot of your work. And you're not going to do something that somebody doesn't want, and you're not going to be, if they want a little bit more, you'll do that too, but you'll also tell them, okay, this is what to expect, these are the results, so nobody's shocked after the fact.
Yeah, and there's just not one way that it's done. Everyone has a different approach, style, technique, and that's where it's important to line that up with your surgeon to make sure it matches yours. I feel like a more natural, subtle look gives a better result than something a little more extreme, but other people may feel differently. So that's just my philosophy, and I like what I say is highlighting the good things and getting rid of the bad things is how I kind of approach it. So if you got beautiful eyes, we want to show those off and make sure that that's a focal point. And if you need maybe a little loose skin removed, and that can easily be done too.
So tell me, speaking of that, some of the things that women ask me a lot about is the jawline, and there's a way to inject a certain, you've done this to me, inject the jawline a certain way. There's also another little procedure under here that's kind of new. Can we talk about that?
Yeah, absolutely. So the jawline sharpening or defining has become very popular. That can be done with a non-surgical approach such as fillers in a way that it helps to sharpen and elongate the jawline, accentuate the edge of the jawbone. And this is very popular in men and women. But in women, you want to be careful not to make the jawline too strong or masculinize this area. And sometimes it takes a combination of addition and subtraction. Maybe you have a little fat pocket that needs to be a little bit of mini liposuction done. And what you alluded to is becoming very popular. It's a suture or a stitch that we put under the skin, and it basically tucks it up.
Okay.
And it gives a nice tuck upwards and sharpens that angle. So from the side, you see a nice, almost 90-degree angle of the neck. It's a simple procedure. We do it in the office with local anesthesia. It can be combined with other procedures like a facelift. And it's called My Elevate is the name of the
That's it. I couldn't remember the name.
procedure,
Okay.
yeah. And so, but yes, it's becoming very popular, and it can be useful for almost anybody who just starts to get a little looseness in the neck or who needs a little more substantial lifting. So it is a good option.
Tell me about, so the same people are asking me about this jaw thing, or also tell me about there's certain way to do fillers around the nose for some effect. Do you know what I'm talking about?
Yes.
I've just started hearing about this, so explain that to me.
Yeah, people are calling it liquid rhinoplasty or nose filler treatments. And basically, you're placing the filler in areas that need maybe to raise a depressed spot, such as the bridge of the nose, or maybe there's a little hump that you're trying to level off, and that can be done with filler placed in the right places. So it's kind of some illusions, really, when you look at the shape and shadows, and you can play with that and to get a different look to the nose. So it's quite fascinating.
How long does that last then, if you're going to do that, the filler?
It depends on the
nose.
type of filler.
Yeah.
The hyaluronic acid ones will last you maybe 6 months to a year. If you're using something more long-term, you can probably get about 2 years or so out of it. It is an option for those who have minor corrections or who are not interested in having a surgical nasal surgery. So it just depends on what your goals are. But a lot of people are doing it because it's simple to do. But you have to be careful. It's a very delicate anatomy. There's risk involved, so you want to make sure that the person has a lot of experience and can deal with any problems that may come up.
Well, so speaking of, let's talk about some of the fillers that you use, and I'll tell you my favorite is the Kiss and the lips.
Mine
That's
too.
the one you used last time on me, right?
Yes.
Because everybody says my lips are so gorgeous and they don't look over-plumped, overfilled, and they feel natural, and I love that filler. I really do.
Yeah, it's my favorite one for the lip as well, and it's because it just highlights or enhances the lip. It does not make, the dreaded duck lips or whatever sort of thing that people do not want, but it just helps bring out the borders, get more defined, smooths out the fine lines that may appear on the surface, and just gives it a little bit of volume without overpowering the lip.
And it's lasted me a long time, and I don't feel those lumps and bumps that
Yeah,
typically from the other
that's the
fillers
other
that I would
advantage.
have in the past. And it does last me a long time, and I always, in the morning, I love in the morning waking up with no makeup on because my lips look all fresh and plumped, so.
Yeah, it's an awesome product for the lips, and that's pretty much all I use there. And the patients, they love it as well. It's a very popular choice for lip augmentation.
Now, some of the things that are no downtime but really beneficial for the skin we've done on me with CeraGlow.
CeraGlow,
So
yes.
let's talk about that.
Yeah, CeraGlow is a technique where I'm adding a little filler, maybe some Botox, as well as other serums that help to address certain skin conditions. For example, pigmentation, fine lines, what have you. It can be customized to address those issues, and it's microneedling into the skin small amounts of this solution. It's very easy. Maybe a little discomfort, but
it doesn't hurt at all.
yeah,
I mean,
most people do not
yeah.
notice anything.
But I did notice that the last time I had it, my skin for about a week looked beautiful and glowing, and people were saying, "What did you do to your skin? It looks amazing." And so that is a great, like if you have a red carpet event or if you have something special, a wedding, anything that you need to go to that you have to look amazing. That's kind of like my red carpet little trick.
Yeah,
now.
that's my go-to.
Yeah.
When someone says I've got to look good for something here coming up, and I cannot take any chance of having a bruise or something, some redness or whatever, and it's one of those things that I know will make a patient look great and not have much risk at all, if any, to it.
Now tell me about the lasers that you have at your
Yes.
office, because I know we've done some on me. We've done the Halo, I believe it was, correct?
Yes.
Morpheus, is that considered a laser or is that considered a
That's more a radio frequency
radio
treatment.
frequency? So let's talk about the difference when you would use one or the other.
Sure. The Halo is a hybrid fractional laser. It's an awesome one for someone who has a little more sun damage, maybe some more aging signs, someone who needs a refreshing of the skin and addressing some of the uneven skin tone. And we did it for Deandra in the office with some topical numbing.
Yes.
And she did great. I mean, you're a little red for a few days maybe, and that's about it. So it's a great option to have done without too much downtime. A similar laser made by the same company, Cyton, is called the Moxie, and that's more of a lighter type of laser treatment. That's great for maintenance. So that's something we'll probably.
Yeah, I don't think I've done that one yet.
Yeah.
We had talked about it, but I haven't done that one yet.
Yeah, I want to get you on the maintenance program with that.
And then so what does the radio frequency do? That's where I get a little confused as to what that does.
So the radio frequency procedure you're referring to is Morpheus. It's using microneedles, except the difference is that these microneedles not only penetrate into the skin, but they deliver radio frequency energy, heat energy. So that heat treatment causes collagen production, firming, tightening of the skin. Whereas the laser is mainly on the surface. It can't go very deep. With the microneedles, we can penetrate further and deliver that treatment. The advantage is folks with darker skin, they can have this without any problem worrying about it causing hyperpigmentation. And it can be done any time of the year. So you don't have to worry about, if you're gonna be in the sun too much.
And it didn't hurt me when I had it done either. So that's another thing. I didn't feel the pain. It wasn't, there was not a lot of discomfort. So, and you have done really well at keeping me comfortable the whole time, every procedure I've ever had. So that's also very important.
Yeah, it's a good option because of those benefits, but you can also pretty much treat anywhere you have skin, whether it's your arms, your legs, your neck, décolleté, hands. So it's another one of those versatile treatments that become very popular. And I think, for someone who just needs a nice tightening rejuvenation without too much downtime or discomfort, this would be a good option.
Now you also have, traditional, like you have the Pico, and that's for, is that correct? That's for the...
Yeah, that does a couple things. It helps with...
Is that IPL, BBL? What would that fall? What category would that fall
That's
into?
a laser. That's a Pico-like type of laser. We do some Pico facials with that, and as well as it can also be used to remove tattoos. But what has really become very popular in our office is the BBL, broadband light from Cyton. It's just a type of IPL or intense pulse light treatment. And it's the best one out there. And it's specifically designed to address pigment, whether you got some brown spots from sun exposure or some redness. And it is a type of light treatment that basically causes the pigment to come to the surface of the skin, and then that starts to slough away over a few days.
I think that's pretty much, and I wanted to say it right, that's kind of replaced that traditional IPL.
Yeah,
from the past.
it's the
it's
gold
much better.
standard.
Yeah.
They recently upgraded it so that you can treat an entire body in minutes.
Oh, wow.
So it's lightning fast now, and no pain, and we don't even use numbing cream or anything like that. So yeah, patients are lining up left and right for that treatment.
Well, you have a wonderful staff at your office. They're all very accomplished. They're all great to work with. And Sarah's the esthetician that we were talking about that does those procedures. And I enjoy working with her when I go in. So everybody in your office is just, they're very knowledgeable. They work well with you. And I've enjoyed being a patient. So.
Wow, you've been great. You know, we've so loved having you as our patient, and you know, just kind of seeing the journey all go along. For me, the staff have to be at the top of their game. They've got to know the treatments inside out. They got to know the conditions they're treating and what the different options are. I emphasize a lot of education, training, and making sure they really are masters of their craft. So whether I'm doing a treatment or I've delegated it to Sarah, I want to make sure I know that you'll be in good hands.
So Dr. Ho, let's talk about the future technologies, the future in anti-aging, which I'm always very interested in, and what's coming up. What are some new things?
Well, the good news is the future looks bright. It looks great. We have some very exciting things that are already available. One, for example, is the Easy Gel. What that is taking some blood like you would for a blood draw. People are familiar with PRP. In this case, it's PRF, platelet-rich fibrin, and then mixing that in a way that you produce a gel. So this gel becomes your own filler, and you inject that.
Okay.
So it takes the growth factors, some stem cells, and regenerative qualities from your blood, concentrates that into a gel form that you can now inject like a filler.
Well, I did not know about this.
Yes,
so this is the
how
first
exciting.
time. This is breaking news for me because this is something you have not told me about, so I'm excited about that.
Yes, we're going to get it done for you. But it helps great around the eyes where we get kind of the hollowness, the skin gets thin and crepey texture quality to the skin. So it helps improve all of that. But the beauty is it's 100% natural. There's no chemical foreign material of any sort, so you cannot get an allergic reaction or anything strange like that. You know it's from you, 100% natural going in. And so we just started doing those treatments, and the patient feedback has been phenomenal. Patients love having a natural option, and this is one that we're very excited about. There's other things too that are still on the horizon. I think there is a topical neurotoxin. So imagine Botox in a topical
like a serum
cream
or something?
Yeah. They're still working on exactly how it's going to be dosed and so forth, but that may be a way to say goodbye to needles.
Would that be like a temporary situation, or you'd have to put it on every day, or do they know yet?
I'm not sure what the duration is. I've heard different numbers from similar to what you get now to even longer, believe it or not. So we're hoping that that's the case, because that's the question we always get is, you know, what can I do to make it last longer? So they're working on it.
Well, I can tell you, being in the skincare business myself, there is nothing that replaces the skills of an excellent plastic surgeon like Dr. Vu Ho at Beyond Beautiful. Because even though I can put creams and things on my skin all day long, you and your expertise and what you've done to my skin on top of the things I do at home have been just amazing, and I want you to know that.
Thank you so much. Thanks for entrusting me. And you know, I've just thoroughly enjoyed working with Deandra because she is very open-minded to the different procedures that we have to offer, and that makes my job easier when a patient says, you know, doctor, what do you think? What's your best recommendation? Because when I am limited, that kind of restricts my ability to really fully utilize all the tools that I have.
Yes.
So I really enjoy the freedom to
Well, I trust you, and
yeah.
it's about building that trust with your plastic surgeon, with your doctor, and because we have that relationship and I trust you, I know that you have my best interest always
Absolutely.
and my best face at heart.
Absolutely. And it is a relationship, and it's one that you want to make sure the person you're working with is someone you can really work well together with. But this has been an awesome discussion. I think we touched on several things that hopefully are of interest and helpful to some folks, and be excited about other things that are already here but also on the way. So the future of anti-aging, cosmetic procedures, plastic surgery, all of that, this is a golden age for all of that, and so it's a good time to be living and being able to take advantage of it.
Well, thank you for having me on your first podcast today, and I'm honored to have been a guest.
Thank
and
you.
I can't wait to come back, and we are going to come back and talk about more things that you're doing to me to keep me youthful, right?
Yes.
Okay.
Stay tuned for more.